This morning on BRN, train your nose and improve your mind. Joining me now is Thomas Hummel, professor of olfactory sciences at the Dresden University of Technology. Professor Hummel, great to see you. Thanks for joining us on the program this morning.
That's actually my pleasure. Thanks for the invitation.
Absolutely. And look, as I was explaining to you in the virtual green room, mental health is something that we have covered on this network. It's so important regardless of your age. And I'm sure just like it is where you are, it's something we're talking a lot about here in the United States of America. And I want to start off by asking you, what's the connection? Is there a connection between what you smell, your nose, and your overall mental health?
Oh, there's a connection on several levels. So like one would be like general well-being, for instance. We recently did a large study where we put together a couple of data from different research. And what we found is a weak but a significant correlation between well-being and your affective sensitivity. So there's something there which is quite interesting. Some on a different level, just not talking about cognitive effects, for instance, about sexuality. The better your sense of smell, the more you would enjoy your sex life. So these are all like effects that you would not expect for affective function. So it figures into that. When it comes to cognitive function, there's a relatively clear correlation there between affective function and cognitive functioning. Or you can turn it around. When people lose their sense of smell and they have like an unexplained affective loss, then they are much more likely to also show cognitive deficits compared to people with a normal sense of smell. You see that especially when people are aging. So in older age, I'm talking here about unexplained affective loss, not about affective loss due to a trauma or to a sinusitis or to a viral infection. So that's not what I mean. But unexplained affective loss has a relatively clear correlation with decreased cognitive abilities, like with your mental health. That what you see there.
Yeah, and doctor, is when you look at the senses, and I know you're focused on olfactory or smell, but is it more pronounced in terms of the correlation with mental health with the nose and smell, or would you just or reason that maybe what you see or what you taste or what you hear might have the same impact on your cognitive function and your mental health?
Oh, that's a question that I cannot really answer. So, but you see it maybe on a different level for mortality. There's also a correlation there. So when you have unexplained affect loss, again, same thing, then your risk to die early is like by a factor of 3 or more increased. And this is significantly more so than for other deficits that people develop. So there's a clear role of the sense of smell as an indicator, as an early indicator of of issues in your body, that something is going wrong. And so you see it for mortality as an overarching umbrella thing, about health as such. And I guess this also could be similar in mental health, but I have no clear data on this.
Yeah, I mean, just trying to figure out if there's any correlation. I guess that is to be tested and researched in the future. What is it about smell? Is it that certain smells trigger memories in the brain or in ourselves, and that triggers some level of cognitive function?
Yes, that would be the idea that you have that odors, they are emotional stimuli. You have this all the time. Every time you smell something, you activate your emotional centers in your brain. And if you don't have that, if you're losing that, then these emotional stimuli are missing, and you lose lots of bouts of happiness or of fear or anger that are streaming through your brain and activating you in a very emotional level. And I guess this contributes a lot to our cognitive, to our well-being as such. So you see it, especially when people lose affective function, then it comes out very clear. Then people lose not just their sense of smell, but they also lose also happiness, if you will. They become more depressed. So we see like a correlation there with people with affective loss and depression, for instance. So like 2/3 of the patients who come to our clinic with olfactory loss, they show signs of depression. And when they improve in olfactory function, when they recover from that, then their depressive symptoms go away a little bit. So that's what you can see there.
Yeah, and in terms of do we lose our sense of smell just over time, like as we age? Do we lose just like we lose hearing, um, just to our environment? Again, I know you're not researching hearing, but we do lose our hearing over time as we get older. We're exposed to different stimuli. Does the same thing happen as we get older? We just we don't smell grandma's brownies as well as we used to.
Yeah, sadly so. This is really the sad truth. Like it has been known since like the 1900s that we lose our sense of smell as we get older. When you look at, it's quite dramatic actually, and quite sad. When you look at people older than 75, 1/3 of them has no sense of smell, almost no sense of smell. It's really dramatic. And it's waiting for many of us, should we get older? And if you look at the current population as we age, so then it's waiting for many of us that we will lose olfactory function as we get older. Maybe it's not completely lost, but we lose many of these nuances, the sensitivities there. When you talk about the brownies is not just the plain chocolate, it's like there's so much more. It's also the different flavors, the nutty flavor, oh yeah, the coconut, there's the dusty parts of it coming to your nasal cavity. It's this dry smell of the brownie. So you lose many things, and in the end, you just have the sweetness of the brownie in your mouth, and you may be able to associate that with the brownie odor that you had at some point in your life, but it's still not the same. And another sad thing, we lose also the memories, of these beautiful brownies that we had as a 15-year-old. So no.
And doctor, have we made just like, and again, using the analogy of hearing, we have hearing aids. We have the ability to restore hearing with cochlear implants. Do we have the ability today, if olfactory sense is and odor is so important to our cognitive function, do we have the ability to restore at least partially some of our smell capabilities?
Yes, there are some ideas about that. One is, first of all, like there's a two-layered answer to that. One, we can change our sense of smell, obviously, because our olfactory function, the olfactory nerves inside the nasal cavity, they can recover, they regenerate. Actually, before you started this interview with me, your number of neurons inside the nasal cavity was different from now. So it changes all the time. Like probably every 2 to 4 months, you have an almost complete new sheet of olfactory receptors in your nasal cavity. So it's quite a rapid turnover that you have there. And this is also the basis for some therapeutic approaches that when people lose olfactory function, there's some ideas that you can improve it or improve recovery with additions of vitamin A applied topically to the nasal cavity, or like doing olfactory training that you smell various odors, do it regularly, and then this helps your sense of smell to recover. Maybe what you're referring to is also the other part of my question my answer would be like similarly to the sense of hearing, you would have cochlear implants. You could have something similar for the sense of smell. There would be olfactory implants. But actually, this idea also has been around for some time. There's a patent from 2016, I believe, from Drs. Coelho and Costanzo from the United States. And what they had there is, it's patented there, but there's no, and we also work on such an olfactory implant here in Europe. We have a project that is funded by European Union. It's meant to produce the first steps into such a product in an olfactory implant. There are people from France, from Greece, from Italy, from Germany, from Switzerland, and we as a group, we try to come up with such a device. There's still a long way to go, but what you said, this idea has been around for some time, and I guess now we also have the means to do it. So all the different parts that you need to introduce such a device, they are there. And we also have much more experience than people when they started with cochlear implants. And I think it was in the 60s and the 70s that people had the idea, and it took them almost like 30 years or 40 years to have a product on the table that you could sell to other people. And I guess for an effect implant, we would be faster, but it will also take some time, before there's something there.
Yeah, I mean, look, it's such a vital sense. You'd hate to lose it. And if it's that important to your cognitive function and avoiding mental health challenges like depression, obviously that there's more research to be done, but it's very important. Dr. Hummel, we're going to have to leave it there. Great research. Great to see you. I'm going to go check out my grandmother's brownies, and we look forward to having you back on the program again very soon.
Thank you very much for the invitation. So, thanks a lot. Bye.
And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place. Details, of course, are at our website. And we're back again tomorrow for another edition of BRN. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.